Palliative care, like I said, plays a very crucial role right from the diagnosis.
Now even evidence is building globally
Yeah.
of integrating palliative care early. Have you come across at any point of time bringing in this palliative care way early? How has it helped the patient from, improving their quality of life?
Of somebody whom I knew, and he was diagnosed with cancer, and there were treatments being suggested. The treatment didn't work. If you want to prolong your life, we can do certain amount of chemo and radiation. He declined for the treatment. Another case where the person actually started improving, and this thing, he said, no, even though I am getting well, I would still like to continue for some more time. It has, great value, palliative care. Either way, the treatment goes. And family members are reluctant in telling the patient. When we talk about palliative care, end-of-life care, communication becomes very essential. Not only when the treatment is going on, but towards the end also. Once the patient knows, many good things happen. There's unfinished businesses. Palliative care, while we can start right at diagnosis, hold the patient's hand, take him through the treatment.
One of the things that everybody is echoing and how the healthcare system is also evolving. And someone like me who's very passionate about patient engagement and is constantly saying that consider patient at the center of everything that you're doing.
One thing we all recognize is that cancer is one disease which, of course, it affects the patient, but it affects the whole family. It affects the friends close by. So the whole ecosystem around the patient is affected. Starting palliative care right at the beginning, making that connection with the family and talking the family through the benefits of patient knowing and patient being in charge of his own treatments and whatever needs to be done is very important. How do you support the family members once the patient dies? And we have what we call as post-bereavement counseling. And it is, we offer this to all the family members when the patient dies.
So they felt there is an entire ecosystem that's walking with them through this journey.
Yeah.
And when they realize that something is not working, they're at least confident that the best of it was already tried. This is the direction the entire medical ecosystem or the healthcare ecosystem should start looking at or having that lens of a patient. We learned something when we came to Karunashraya is that, the journey of palliative care is not just ending when the patient is no more.
Cancer is one disease which, of course, it affects the patient, but it affects the whole family. It affects the friends close by. So the whole ecosystem around the patient is affected. You're very right that the post-bereavement support becomes absolutely essential. I think the most difficult are when we get children. Just recently we had a 6-year-old brain tumor. While the child's understanding of death depends on what age they are. After a certain age, they do try to, they understand what's happening. When they're younger, they really don't know what's happening to them. And it's very difficult for the family members, especially the parents. Aspect of children, because they haven't seen much life. They don't have unfinished business. They don't have their own families, So to that extent, it's easier. But if you really look at young people, in the ages of 20s, and it gets very difficult because they have the whole life ahead. They have aspirations, and and especially if they have been, working somewhere, there is always this thing of why me? I mean, when we talk about spiritual distress, this question of why is it happening to me?
Correct.
I've been good, I've not hurt anyone. Why is it happening to me? One of the things that we suggest and which we work with the families is to talk about positive things that the people have done in their life. So palliative care per se is patient-centric. So all these stakeholders, whether they are hospitals or diagnostic centers or anybody who's dealing with the patients, they need to learn that. So they must recognize that each person is different. So unfortunately, many of the oncology centers, they may or may not have a palliative care center. If they do have, I'm not very sure whether they start engaging with the patient right at the diagnosis, which they should do. And unless we really spread this through the government to the public health systems, the government hospitals, the public health centers, the benefit of this palliative care will not reach many people. So that, of course, there has been a great effort now by the central government and the state government to start palliative care setups, but still a long way to go.
So this clearly says that not only just as Karunashraya, right, but also how the entire community should have the same objective of training more people, creating that awareness, be it the hospital ecosystem, the pharmaceutical companies, and even I think educational institutes, integrating this into the academia. What is the value of it, I think is a great takeaway and a learning, I think, for the community who's going to watch this. And it has to start somewhere, and when it starts as a team, there's a bigger impact that all of us can deliver. If you want to share something for patients and caregivers.
Now the message, of course, would be that having a diagnosis of cancer is not end of the world. Family members should encourage the patient to be part of the decision making.
Yes.
And that also reduces the caregiver's burden.